Hi there, my name is Karina Regnier, and I'm a nursing student here at Marquette University, and today I'm going to be discussing Peplau's theory and answering the clinical question of why is there violence against healthcare workers? The issue of violence against healthcare workers has been an ongoing concern, and there is a need to understand why it occurs and what strategies can be implemented to prevent it. Peplau's theory of interpersonal relations is one of the theoretical frameworks that can be used to address this problem. The purpose of this video is to review the literature on how Peplau's theory supports addressing the issue of violence against healthcare workers and to describe intervention strategies that have been used to address this problem as well. So, Peplau's theory of interpersonal relations emphasizes the importance of the nurse-patient relationship in promoting health and preventing illness as well. The theory focuses on three main stages. The three stages are orientation phase, working phase, and resolution phase. According to Peplau, the nurse-patient relationship should be a partnership based on mutual respect, trust, and collaboration. So by using these different phases, we are able to create a proper patient-nurse relationship and create a good rapport, and as well as establish a trusting baseline as well. So a study done by Peden Extension All in 2020 was done to look in depth at Peplau's theory. And so this model showed the three phases: orientation, working, and resolution phase. Orientation phase is involved in creating a welcoming and open environment for the patient and the nurse as well. And so the next phase it will lead to is the working phase, and this is also known as the nurse prevention phase as well. So in this phase, the patient and nurse will work together in order to create a plan that the patient feels like they have autonomy and that they are able to advocate for themselves to create a new healthcare plan for themselves and feel like they have a say in their own care. And this will eventually lead to the resolution phase, where the patient is able to gain independence and also find meaning in their own healthcare again as well. And so I used Peden's source to help me create my conceptual model to use these different phases in order to find interventions that help against healthcare, to help against violence against healthcare workers. The study also found that Peplau's theory was able to be applied to proper patient-care relationships in a variety of different settings. So there are several different strategies that can be used to help prevent violence against healthcare workers. Several intervention strategies have been used to address this issue of violence against healthcare workers. A study of Zhang Extension All in 2021 was used to develop a nurse-patient communication intervention to prevent patient aggression. The intervention focused on improving communication between the nurse and patient and including active listening, providing emotional support, and using appropriate nonverbal communication. The study found that the intervention improved the nurse-patient communication and also reduced patient aggression by receiving the appropriate education. Another study by Ningham Extension All in 2019 was used to develop a violence prevention program against for healthcare workers. The program included training on communication skills, conflict resolution within the healthcare systems, and self-defense techniques as well against patients. The study found that the program reduced the incidence of violence against healthcare workers and improved their confidence in dealing with violent situations. So as nurses, we are trained to be adaptable and to be ready for dynamic changes. So if we are able to prepare ourselves for these adverse events that could happen, we are able to mitigate the situations better as nurses. Another third intervention was used to develop patient-centered care, and so this was used to support and prevent violence against nurses. The intervention involved training on nurses creating a supportive work environment that used patient-centered care. The study found that interventions improved patient satisfaction and reduced the incidence of violence against nurses. So with even small things of patient-centered care, like making sure our patient has enough water and just doing those little extra things is what this article was mentioning in patient-centered care as well, is that the small details do really matter to patients. So now we're going to apply these interventions. So for Paplow's theory is appropriate for explaining, describing, and predicting the clinical problem of violence against healthcare workers. The concept of the nurse-patient relationship was central to addressing the problem, and Paplow's theory provided a framework for understanding how to create proper patient relationship to prevent violence. The research evidence supported that the use of Paplow's theory to develop interventions to prevent violence against healthcare workers, and there didn't really seem to be any conflicting research about that they shouldn't be receiving education. There's pretty much a general consensus that if we are able to educate our nurses ahead of time, that we are able to prevent a lot of violence as well and able to mitigate the situations better. So some of the implications for the nursing practices that could be useful for healthcare workers would be being trained in communication skills and conflict resolution, as well as self-defense techniques can really go a long way as well, whether these are verbal self-defense techniques like keeping things open, not antagonizing the patient as an example, as well as we can create a supportive framework environment and promote patient-centered care, like I said. So we can reduce the incident of violence through these interventions. For the future research I would like to focus on evaluating the effectiveness of interventions that are used by Paplow's theory to prevent violence against healthcare workers. So by using these interventions, we are able to protect our nurses and as well as maintain our behaviors of our patients, because sometimes our patients can act unpredictable and we may not know how to respond as nurses, and as well as we may have an instinct to respond a certain way. So if we are able to be trained ahead of time, not only in how to respond, but also how to protect ourselves as nurses, we are able to help use these situations that lead to less violence as well. So in conclusion, the selected theory of Paplow's interpersonal relations is appropriate to explain and predict the clinical problem of violence against healthcare workers. The theory provides a comprehensive framework that emphasizes the importance of the nurse-patient relationship and partnership, which is crucial for promoting the patient-centered care and preventing violence. The literature we also reviewed during this video helped reveal a balance of evidence, with many studies supporting the use of Paplow's theory in developing intervention strategies aimed at reducing the violence against healthcare workers. However, there are some conflicting findings which highlight the need for more research in areas. So this is what we need: more development on the effectiveness of these trials going on and how effective they really are, as well as it would be interesting to know what particular patients are committing these violent acts towards healthcare workers, and perhaps if we were to target a specific group that may commit these acts more than others. For example, alcohol patients tend to sometimes act aggressive due to alcohol withdrawal. So this would be a subset group of patients that one could perhaps examine compared to perhaps the elderly, who may not be as aggressive or who may be just as aggressive. So more research for specific groups of patients that commit healthcare acts against violence is necessary as well. So the implications found in today's video are significant, as the findings suggest that the interventions based on Paplow's theory, such as communication skills and training in conflict resolution and patient-centered care, can effectively reduce the incidence of violence against healthcare workers. Therefore, it is recommended that healthcare organizations provide training and support to promote effectiveness, nurse-patient relationships, and prevent violence. Future research should focus only on evaluating the effectiveness of these interventions and exploring the impact of other factors, such as, like I was saying, organizational culture, and also what groups are affected, and as well as diving into leadership and the hospital's policies as well, and creating a standard policy across healthcare in general of if a patient is to hit a healthcare worker. Overall, Paplow's theory of interpersonal relations offers a valuable perspective for addressing a complex issue of violence against healthcare workers, but emphasizing the importance of the nurse-patient relationship and partnership. This theory is a guide and was able to guide me using nursing practices, and as well as being able to find interventions through research that help show promoting safety, quality, and respect in healthcare settings is able to help prevent violence against healthcare workers. That is all I have for today. Thank you for coming, and my recommendation is that we get some extra education for sure and create more standards that are based throughout the healthcare field. Have a great day.